Hey everyone, we are back and kind of shifting gears here. So we started with our family practice because we did trauma surgeon yesterday. Now we're going to go over to physician assistant. So I don't remember. Do you have the history of the PA in here?
Yes. Yes. It's, I always do a did you know slide. So it's
Yeah.
when, yeah.
So a lot of people don't actually know this, and even PA students don't know it. There's a few programs that still teach it, but I know down here at one of our PA programs, they actually have a whole section dedicated to this. But either way, hey everyone, welcome back. So for the next hour or so, like I said, we're going to be talking about physician assistant and also the SP core. So it's specialist core. We'll kind of lump both of them in there.
Yeah.
So I see some people kind of dropped off a little bit. That's fine. So if you're on the channel, go ahead and share this, tag some people. So if there's anybody who's interested in a PA program, interested in medicine in general, send this over to them, send it in Messenger, tag them, have them join us, because what we can do is we can actually answer the questions live. That way, if anybody's on the fence about it, or if they just need some guidance on how the process works, or just what a PA does, I mean, we can answer those too. Let me get this screen shared here. All right, there we go.
Okay, good stuff.
So agenda, same thing. All right.
Yeah. Yeah. So, with the PAs, as we mentioned, this is the PAs are part of the specialist corps. The specialist corps is one of the Army's most competitive. Their boards are some of the most competitive when it comes to in selection and promotion. So we are definitely looking for those PAs who are well qualified. You must have the right clinical experience. It's
Yes.
a must. The specialist corps, their board only meets once a year. However, PAs are the only jobs within the specialist corps that applicants can go to the board every month. So that's really, that just shows how bad, how much we need PAs. So just a little historical fact. So with PA week, previously PA week, PA day used to be celebrated once a year on October 6th. But now there was two reasons they did it on October 6th. One was because October 6th was the day that three Vietnam era Navy corpsmen, that was when they first graduated from the PA program. And then the other reason that they celebrated it on October 6th was because of Dr. Eugene Steed. He's the founder of the PA program, and that's his birthday, October 6th. But now it's an entire week for PA week, October 6th through the 12th. So it just shows that with Dr. Steed, he went to Fort Bragg with two other physicians to observe the training for some special forces medics. And he was so impressed with their training, and he was like, man, they are able to operate on their own. So he was so impressed by their training that he was influenced to go ahead and start a PA program at nearby Duke University, because they were at Fort Bragg, which is not too far from Duke University. So they kind of led to the whole development of the PA program, and eventually the Army, 1971, I believe, it was their first PA graduates.
Yeah. And even today, there are, I believe it is actually Duke, and I think UNC, they do some of the transition programs, taking 18 Deltas. So if you don't know, that's Special Operations Combat Medic, and transitioning them to PAs. There's also a lot of new schools that are doing the same thing for standard 6-8 whiskeys, because they'll do almost like a skills assessment and kind of see where they're at and what they've done, and some of them can get fast tracked. And I know a friend of mine that I deployed with did that exact thing.
Yeah, and with our PAs, one thing about the Army, with our PAs, you have a lot of autonomy as well, like a physician. So there's, in certain settings, medical settings, PAs are the only healthcare providers. You have your medics and your PAs. So it's definitely the leadership and autonomy you have as a PA in the Army. It is great, and you definitely get trained up, and the mentorship that PAs receive in the Army, it's above all. So here's talking about some of the job duties as a PA. One of the main ones is as we mentioned, the PAs, you train the medics. We rely on the PA medics. Well, rely on PAs for that guidance and that mentorship. Just because the medics are looking to and hone their skills as well. Because it's the medics that are going out there with the infantry soldiers, making sure if they are injured, that they're able to that they're stabilized and returned back to the rear to receive that higher echelon of care. So we rely on the medics rely on the PAs for their training. Also with PAs, they're involved with trauma management. So you get a lot of experience and training in trauma management as an Army PA. You interpret X-rays and tests. You advise soldiers and commanders on when it comes to medical related issues that may impact the soldier or the mission.
Mm-hmm. One thing I do want to say, so as far as the job duties, I would almost say there's three distinct like kind of roles for PAs. So we can kind of go through those. The first one is working in what we call the BAS, Battalion Aid Station. That is where you typically find your medics and your PAs. So what you're going to have is the way that it works is within a medical platoon for a battalion. If you don't know size of battalions, they're typically accounting for about 1,200 soldiers. I think that's about a good number for now. They go up, they go down, depending on the type of unit and whatnot, but that's a good estimate. And what you'll have one medical platoon sergeant. So that typically enlisted an E7 sergeant first class. You'll have two staff sergeants, which is going to be like your treatment NCO, who oversees all operations for that BAS. That's your day-to-day. They're the ones doing the manning, the ordering, and stuff like that. Then you're going to have your evac NCO. And your evac NCO handles your triage and evacuation. So they handle everything on the outside. And they also handle the medics when it comes to your ambulance drivers and managing your senior medics for the lower echelon, so your company level senior medics, stuff like that. So within a typical medical platoon, you're going to have about 30 medics, give or take, again, depending on the type of unit. They're all overseen by one PA. That PA is responsible for coming up with their concept of operations. So if they're going out to the field, if they're going setting up a battalion aid station out in a field environment, that PA is going to be the one working with the medical platoon sergeant saying, hey, this is where our stuff needs to be located. This is our entry point. This is our triage point. This is what we call the DIME or ID me. So your triage categories. This is the flow through the aid station. This is what's going to go when you go out the back to the evac sections. Like, they're responsible for coming up with the overhead view of everything going on. It's the treatment NCO's job to make it happen. And all the NCOs to make that happen. The thing that also happens with them is they tell the medics what they can and can't do as far as their scope of practice. If they're comfortable with a medic doing an enhanced scope of practice, far above and beyond what an EMT basic can do. I mean, I've personally trained like brand new junior medic E2s how to do things that paramedics can't even do. Like, I've taught them how to do chest tubes, like in the back of a vehicle. Like, granted, did they do them on somebody live? No, but guess what? They got trained, they got competency, and if need be, they can do it. But if you notice, there's a piece missing that's not here. There's no physician. Like, the physician is not down there at that aid station. They're not directly overseeing everything a PA does. And this is one of the biggest draws for PAs, and that we want to get the information out. You are an independent practitioner. Yes, you do get your stuff vetted and overseen by typically your brigade surgeon. So you're going to have a doctor that oversees, but it's not going to be the micromanagement level that you typically find within a hospital system. So it's a very unique position. And if you come in with a skill set that is not normally a PA skill set. So for example, if you're a physical therapist and you also are a PA, you can incorporate your physical therapy experience into your PA practice. Same thing if you've trained under an osteopath. Like, you can take those osteopathic manipulations, as long as your brigade surgeon can verify that you're competency in them, you can incorporate those into your practice as you see fit. So they are given such freedom when it comes to how they want to manage their patients, that you will never see it on the outside. You just won't. As far as when you were previously enlisted as a medic, what else have you seen that the PAs were able to do that, besides the training, that you just haven't, like, you've never come across it since then?
Well, it's like you really, a lot of the things that you said, yeah, the PAs were in charge, and the brigade surgeon or their physician would be at an entirely different location. So it was that PA running the show. Two medical fields we definitely look for PAs to be experienced in, that we would like for them to be experienced in, is emergency medicine. So we're definitely looking for PAs with that emergency medicine and orthopedics, because the Army is real big on that sports medicine model. So we're definitely looking for the PAs in those type of training. But when I was in Iraq, our PAs had a PA. He was worked in the EMT, which is the ER emergency section for the Army. We call it EMT. But yeah, the doctors felt real comfortable with him running the overnight shift. They were always available if they were needed, but he was running the show at night with us. And so they definitely suturing. They were teaching the medics or training the medics on suturing. So they definitely did a lot when it came to helping out the medics as a PA.
So that's kind of the emergency medicine side. And like we said, we look for certain skill sets with PAs. So emergency medicine is a big one. And I would almost venture to guess to say that's almost a requirement to have.
Yeah.
One of the other sides that you see PAs is in your TMC, so your troop medical clinics. So that's your family practice clinic. That's your doctor's office. Like, you make an appointment, you go in, you get seen. There's a very good chance you get seen by a PA. You'll get seen by the nurse or the medic. They'll take your SO and your vitals and stuff like that. Sometimes your more senior medics will actually start going through some tests and go through an assessment and a plan. Then what they'll do is they'll take that to the PA and for verification. And the PA will say, yep, go for it. And the PAs can prescribe medications. The PAs can order labs, order RADs. So order radiology tests, order lab tests. They can refer out to physical therapy, occupational therapy, like develop an entire course of treatment for whatever they see fit, and then present it to the patient, and then they're on their way. Again, what's missing? You have a doctor that's not really playing an active role, because we empower those PAs to be fully independent licensed practitioners. So that's one of those things that we preach, is the autonomy of it. So whether you're on the emergency medicine side, treating people in a battalion aid station, or like an emergency medicine section, like an EMS, like you were saying, sir, and then even over to a family practice clinic, they'll manage their own clinic, and they may have, depending on how comfortable they are with the brigade surgeon, they may have their stuff looked at, like have their notes reviewed and stuff like that every once in a while. And I think there's a certain criteria for it, and making sure all their coding is correct and whatnot. And that's the family practice PA. So again, that's an additional skill set. When you want to apply for this, it will give you an advantage over your peers. And you mentioned the osteo side. Osteo/surgery is, we actually have what's called an ASI. So it's an additional skill identifier. And I believe it's the M1 for PAs, if I'm not mistaken. And it's an additional job code for those PAs to go further down the surgical route, the surgical and sports medicine route. So they can manage everything from emergency through long-term acute into the orthopedic care. So that's kind of those are those three distinct fields that the PAs are in, but we do really try and preach autonomy with that.
Yeah, exactly. Right. So next, I guess we'll talk about the initial officer training. So it's pretty much the same for the other jobs as well, with physicians and other officers, medical officers within the Army. So with the initial officer training, it's the with PAs, the direct commission course in Fort Sill, Oklahoma. It's 4 weeks long. And then the BOLIC for active duty PAs is 9.5 weeks. And for the reserves, it's 4 weeks for the PAs. In the reserves, there are 2 phases. The first phase is all online for the BOLIC, and the Army Reserve gives you, they give you an entire year to complete the online portion. And then once you complete that, you go to the resident portion, which would be 4 weeks at Joint Base San Antonio in San Antonio, Texas. And also with the Army Reserves, just like with physicians, they give you 3 years to complete both courses. Active duty, you complete it sooner because there's more slots available, and the courses are offered multiple times, throughout the year.
And this kind of, I know we touched on this back when we were talking about the family practice, but you do have kind of a say a little bit in where you want to go for your phase 2 for your PA. So if you come in as a brand new PA for your assessment, like they said, they went to Fort Polk to kind of isolate themselves and keep studying. That's more the student side. So as far as where you go on the active side, that's definitely a conversation, but so I kind of got a little bit ahead of you, but yeah, this is the entry requirement. So this is reserve, like he's talking, you have 3 years to complete it. On active duty, you're going to kind of hit it back to back before you go out the door.
Exactly. Yeah. And I commissioned I worked with a PA here in Kentucky. He actually went active duty. He was in the Army Reserve. He was mobilized for a year to Fort Bliss in El Paso, Texas for a year as a PA. And he was basically doing case management. His wife was a stay-at-home mom with 3 kids. So I know we mentioned this previously. He brought his family with him on this mobilization for a year. Of course, it was on his own dime, but they stayed off post. And when he came back from the deployment, came back to Kentucky, he was like, man, I just missed the autonomy I had on active duty. So we worked together and got him selected, and he's back on active duty now. He actually got his duty station. He was from Kentucky, and he selected Fort Campbell as one of his top 3 choices, and he got Fort Campbell. So his family, they're all happy. They're at Fort Campbell doing good things, and yeah, he's definitely enjoying it. And he had that orthopedic experience. So he actually did the Army PA program. He was enlisted whiskey, combat medic, applied for the Army PA program, student program, was selected, completed that, and the rest is history. Just wanted to mention one thing about the Army PA program. You have to be currently serving, in the Army, Navy, Air Force, to apply for that program. So it's not open to the general public. You have to be currently serving to apply for that program. And that when you apply, the recruiters, we can definitely help you with the packet. Typically, we don't lead that process, but if you have questions about some of the paperwork and things like that, we can definitely help you with that.
Yeah, I think that's so after we go through the PA, so we're talking about like the direct accessions right now.
Exactly.
So again, we're the Army. We have a lot of words that we use. So when we say assess, that just means it's like an onboarding process. We're bringing you on into the Army. As far as the PAs are concerned, what we'll do is we'll kind of go through the active/reserve that are currently practicing or soon to be graduated PAs. And we'll also then talk about some of the student opportunities because we got a little bit of time to discuss those. And like I said, we'll talk about IPAP, and we'll also talk about the little known program that was just addressed about 2 weeks ago on Facebook. So stick around for that one.
Cool. Okay. And then we have the assignment opportunity. So just like the other healthcare professionals with PAs, you're assigned to an Army Reserve medical unit or a military treatment facility. As you mentioned, the battalion A station as well, which is a field setting for PAs that gives them a lot of autonomy. We also, PAs have the ability to do research in the Army. So if there's PAs out there interested in that opportunity would be available as well. You can teach at the schoolhouse, new PA students. You teach them at San Antonio or one of the training locations. And then also you can, for those who want to do the elite stuff, the cool guy stuff, you can serve as a PA with special forces, supporting the special forces or Rangers.
Yeah. And I've personally worked with one that worked in with regiment. So it's, if you do want to go do the cool guy stuff, jumping out of airplanes, like rappelling from helicopters, you can do that. Or if you don't want to do that, you don't have to. So it's one of those things, like people see things on TV, everything that the Army does. It is not all kicking down doors and stuff like that. That is, we're not looking for people to do that.
Yeah.
We are strictly looking for medical professionals. If you have questions about that, again, you can go ahead and text AMMZ to the number below, and they'll put you in contact with one of the recruiters that does talk about all the cool guy stuff. So those opportunities are definitely available when you talk about actually most medical specialties. If you look at the more acute side, more the trauma side, their opportunities are available for that. As far as the career positions, I'll let you go ahead and take the Army Reserve, but the active duty, I'll kind of cover a little bit too.
Sure, yeah. So with the Army Reserve, I know PAs in the Army Reserve who have served as commanders of Army Reserve unit. I actually know a PA in the Chicago area in the Army Reserve. She was the commander of a Army chemical unit, and so she said she learned a lot. So just to go back on what our battalion commander said, Colonel Blue, she said, sometimes the experiences that you don't, those assignments you didn't select, they give you the best experience. And that PA definitely echoed that sentiment. She said she enjoyed her time as a commander of a chemical unit. She learned a lot from her soldiers, and it just made her a better leader. Then also we have PAs who, on a senior level staff, so I didn't want to get too technical when it comes to the military elements, brigade, division, but basically you can be on a PA like on a staff of a colonel or a general. If you're on that type of staff, there comes more responsibility and leadership opportunities. Then also you can be a consultant to the Surgeon General of the Army, so the Army Surgeon General for the Army Reserve. So these are the PAs who work in private practice, and they are reviewing the qualifications for PAs who are interested in joining the Army Reserve.
Yeah. On the active side, again, how we've always talked about before is we're constantly pushing people to take over leadership roles, to move out of their comfort zone, to do something outside of their normal scope of practice. So again, commander of a unit, and the cool thing is you did put Army unit. That means it doesn't say medical unit. Yeah. It can be anything. So for example, I was in a cavalry unit commanded by a military intelligence officer. I've been in several units commanded by ordnance. So if you don't know what ordnance is, that's anything material related, trucks, like any supply type situation. I've had ones run by logistics officers. I've had ones run by MSC officers like yourself, sir. So there are certain positions that we call are like branch agnostic. So you don't need to be part of a certain branch to take over those. And this applies to PAs as well. So they can take those leadership positions. And like we talked about before, it's like, okay, I want to go to the beach. Like, yeah, but we have this position over here available that will serve as kind of a launch pad for getting your career taking off even faster. Yeah. Consultant to OTSG. So Office of the Surgeon General. That's acronyms. So the consultant, same thing. When we send somebody's CV up for review, we send it to the consultant. And what they do is it is somebody in your career field. It is your peer that looks at your CV saying, this is the type of person we need. And that's what that is. So they're currently practicing as a PA, and this is kind of like an additional assignment. And they review CVs for us when we ask for a review. And then continuing with higher level education. So a PA is a master's program. Yep. There's nothing saying you can't continue it into something else. So a PhD in several different disciplines. We have the Army War College, which we call it the War College, but it is a college level program that is in a whole wide variety of different places. And actually, our previous commander, Colonel Ament, I'm going to reach out to you if you're watching this, because I want to try and get when you're actually going through the course, I want to actually get your opinion and sit down and talk to you about it. But the doctorate level degree in for PAs in emergency medicine, general surgery, ortho, cardioperfusion, there's a lot of different methods. Or even if you want to start looking at healthcare administration, public health, like their opportunities are available for you to do that on active duty that we will pay for. So there's that whole side too.
Yeah, they can go to. I know there's a doctorate of physician assistant studies if they're interested in that. Yeah.
So it's not like we're just gonna work you as a PA until you retire in 20 years. No, we want you to go on and do bigger and better things.
Exactly. It's actually mandatory. So if you're just thinking and
that's true.
Yeah, as you move up, if you're deciding to make the Army a career, like 20 years, it's mandatory that you move outside of your comfort zone. You just can't stay in patient care. Yes, that's great. We need you, but you got to accept those other positions of that have greater potential, high levels of responsibility. Eventually, you have to start, moving into the administration part as you move up in rank. You just can't continue to. We're happy if that's what you want to do, just do patient care your entire career, but eventually you just have to branch out and in the PA field.
Yeah. Going through some of the entitlements. I mean, we're not going to cover the base pay, incentive pay. I mean, I'm pretty sure we beat this to death, honestly. Yeah. So if you're watching this as a snippet later, you can easily jump back to one of our previous and just honestly look for this slide. So the reason why all of our slides look the same for this is we break it down, but typically we're not talking to a broad audience at a given time like this is. So we're talking to a PA class. Yeah. We're talking to a residency program. We're talking to the internal medicine department of a hospital doing this presentation. So we have it tailored specifically for them. Pretty much the things you want to look for is, honestly, here's your totals down at the end. And your loan repayment. Those are going to be your two biggest pieces. Yeah. Everything else, honestly, shoot us a text or text AMMZ, and what we can do is we can put you in contact with a local recruiter that can sit down and take you through this line by line for your location. Yeah. And that's kind of going to be the biggest thing, because whatever happens in Akron, Ohio, isn't going to happen where you're at in Cincinnati, and it's not going to be the same as down in San Antonio.
Exactly. And as you mentioned in the previous presentation, for the Army Reserve, that total is to basically going to supplement your current job. Yep. So the Army Reserve is, the Army Reserve, they're not trying to take you from your current job. You will continue to work at your current job. And it was just,
you have to.
Yeah, exactly. Yeah. And it would just supplement that. And that's basically, that total is based on 35 to 40 days out of the year is what that total is based on. All right. And so with the eligibility, so must have a master's degree with a strong academics in the hard sciences, which is like your chemistry, your biology. I've talked to PAs who went through the Army, the IPAP program, and I think I was a medic at the time, and I'm like, what classes typically a lot of the students in the Army PA program failed? And she did say it was the hard sciences, like the chemistry. That does knock a lot of people out of the Army PA student program. So if you're coming in as a board certified, already certified PA, so we look for that master's degree in the strong academics and hard sciences. Also must be completed an accredited physician assistant program. Mm-hmm. All right, and then for those students who are like, hey. I just graduated from a PA program, or I may be within 6 months from graduating. You can still apply towards become an Army PA. You can still apply. You just must ensure that your overall GPA when you graduate has to be a 3.0.
Yeah. And again, this can change. I know when we talked about nursing with Captain Dulworth, there was a change coming next year. So the level of experience for the nurses we're looking at is now much higher. Yeah. So be aware this may change in the future. Right now we're talking for fiscal year 20, which ends September 30th. we will, if there's any changes to this, we're going to go ahead and update any information that we have. And sir, you and I will probably sit down and do this exact same video again, just with some updated info. But again, your school does need to be NCCPA accredited. We will run that check. We'll check your license. We'll run everything else. And the additional experience in ortho or sports medicine. Now, it's not required, but it makes you extremely competitive. And because you have to think, as a PA in the Army, what population are you going to treat? You're going to be treating generally healthy athletes. We do a lot of physical training. We do a lot of things like that, especially on the active duty side. So you're going to need to understand the sports medicine piece. You're going to need to understand the orthopedic piece to it, not just the family practice, like that method.
Exactly. Obviously, PAs are intrigued by the Army because I believe we are projected to meet our PA mission for this year. If we haven't already made it, I think they're not even accepting any more packets this year, which is
actually surprising because
So obviously, PAs are becoming more intrigued by the Army. So definitely, reach out to us, text AMMZ or to 462-769 if you're interested.
Yeah. And again, same thing, the basic age requirements apply. Between 21 and 42, we say 21 because that's a minimum requirement for becoming an officer in the Army. Now, it can be waived because, like, if you're Doogie Howser and you've graduated early, there may be a possibility that can be waived. But again, that's a case-by-case basis, and we have to look at everything else you've done.
Exactly. With PAs, with it being one of the competitive corps, you have to be well qualified or have some type of special training for them to entertain a age waiver. So
same thing. If you want to go active duty and you're on that 42 border, but you are extremely competitive, you've worked in surgery, you've worked in emergency medicine, you are extremely physically qualified, that they'll, again, case by case, they'll take a look at that waiver. For the Army Reserve, we can go up to 47. So again, extremely qualified, age waivers may apply. It is truly a case by case. So don't disqualify yourself because you think you're too old.
Yeah.
Come talk to us.
Yeah.
And then as with everything else, so going on active duty, as an officer, you need to be a U.S. citizen.
Yeah.
Blanket across the board. For the Army Reserve, it is permanent resident.
Yeah.
That's kind of what it boils down to. So there's no really, it's same no matter if you're a trauma surgeon, if you're a family practice doc, if you're a PA, same across the board.
Exactly.
How to apply? All right, this is all the same from before. So what we're going to do is actually go on to, that is more of the fully qualified PAs, or soon to be. So if you're in a school, or if you're in a program. So a few of the other pieces we have, I know we talked about IPAP. So IPAP is the Inter Service PA program. And so I'm directly talking to people who are in the military right now. Officer, enlisted, warrant officer, it doesn't matter. You can apply. I had a PA who was a major in the Marine Corps as a Huey pilot.
Wow. He
decided, I'm done. I'm done. So what he wanted to do, he wanted to be a PA. So he applied to IPAP. And now he had to take a downgrade in his rank because you're starting out as a junior medical officer, because our medical ranks they're a little bit different. So he did have to take a pay decrease to come to it, but he also made up for it in the incentive pay. So there's that too. If you're looking for that, again, you can shoot it. You know what? Don't send a message to AMMZ. If you do have a question about that, honestly, the best way to do it is if you Google IPAP, so Inter-Service PA Program, there is an Army website. Click on it, take a look at the packet requirements because they do change every year. I know when I had a soldier that was looking at it, applied, got selected. But they needed to have, like you said, it was the hard sciences. They really do harp on the hard sciences. You need to have a good GPA. And also at that time, you needed to submit an SAT score within, I believe it was 5 years. And I've seen that number shift between 10, 7, and 5. So because you don't process through us, it's a self packet. Take a look at it. And the other thing is there is a phone number and an email address on that IPAP website. Call them. If you have questions, reach out to them, reach out to that program manager, because they're going to be the ones to kind of help you through that process. It's like, hey, I know it says I need general chemistry and I need at least a 3.0. It's like, I have organic chem. Is that good enough? If you come ask me, I have no idea.
Yeah.
Go talk to them.
Exactly. Yeah. When I looked at it, looked into it about 10 years ago. It was, you had to have the GRE, not the GRE, the SAT. Also, if any of your science classes were more than 10 years old, you had to you had to retake them. And I was like, wait, I already have a college degree. Like, it doesn't matter. Things change. Things change in science. And when I started enrolled in a local community college, it definitely, I saw how much things have changed over 10 years. So yeah, definitely.
And so the way that works is they'll go through the board process, they'll select people, and then they'll put them on assignment to Fort Sam Houston. You go to Fort Sam Houston and you go through your phase 1. It is drinking from a fire hose. Like, I talked to my old PA about it, and that's back when everything was printed. And I asked him, like, hey, can I see some, like, your books from when you were in PA school? He's like, well, we didn't necessarily have books. We had, like, handouts. Yeah. And he brought in like 3 milk crates full of like printed handouts. And he's like, you'll walk in like one day, they're like, memorized by Friday. So like, that's the level. Like, it is a very intensive course. So make sure you have everything straightened away on your personal life before like you set down that path. Because the majority of people actually fail out of the phase 1. Once you graduate phase 1 at Fort Sam Houston, then you're going to go on to your phase 2. So that'll be at, again, Fort, insert name here, hospital. Like, they're all over the place. One of the PAs I used to work with is a phase 2 clinical coordinator. So she oversees those new PAs that are going through their clinical rotations. I want to say that's a year to 18 months. I can't remember. I know that does change as well. And then they go on, they're a full-fledged PA, and they go on to their unit and they start seeing patients. So that's the way IPAP works. Yeah. The little trick that I mentioned before. So there's a lot of AMED recruiters, because this was posted to our forum, about, is there any program that we can pay your way through a PA is there any Army program to pay for your way through a PA school? Yes, there is. And it's year by year, because if you look at the regulation, this is for all you AMED recruiters. STRAP can be applied toward any AOC that is on the critical wartime shortage list. As long as PA is on the critical wartime shortage list, they qualify. And if you don't believe me, head on over to the AMED recruiting forum and talk to Major Matapano, because he verified it right there. So
wow, I learned something today. Wow. Okay.
Yeah. So if you're a PA student and you're looking at a way to pay your way through it, now, granted, we can't pay your tuition, but we can give you that stipend, that $2,200 a month, and get at least some money into your pocket while you're in that program, because we know you're not working. You can't when going through that program. This is us betting on you finishing that program. So again, if you have any questions on that, you can either text AMMZ to the number below, go onto the link tree and click on the link there. If you get turned away, call my number. We'll work it out. We'll put you in contact with a person that will do it, just because there are some people that still haven't heard about it, still haven't done the digging, and they're like, nope, we can't do it. Next, bye. Yeah.
And then one thing they could do, once they fulfill their obligation, once they fulfill their obligation for taking STRAP for the PA school, who knows, incentives, we receive updates every year. So by the time they fulfill that obligation, then they may be eligible for loan repayment for the student loans taken out during PA school. So for, currently for active duty, they'll pay back 120,000 in student loans for certain medical specialties, and PA is one. They'll pay back 40,000 a year over 3 years, up to 120,000, principal only. Then the Army Reserve currently they pay back 60,000, 20,000 a year over 3 years. So yeah, that'd be great. You know, once they complete that strap obligation, and if there's still loan repayment available, they may be eligible at that time. Now that's years down the line, so who knows what the incentives will look like or the pay plan will look like at that time.
Yeah. So again, if you're interested, and so here's also the thing, I've talked to some people who think they're interested in nursing, going through undergrad nursing programs, and then have made the shift to PA. Because talking about what a PA does, it was never on their radar, because people think, okay, like I want to be in nursing, and actually talking to them about nursing and about what the mentality is for nursing and everything like that. And then presenting, it's like, hey, you do realize there's these other options too. Now, please do your own research on this. Don't just take my word for it. But there have been some people, it's like, you know what? I looked into this PA program and I really like it. Like, what can we do? And I kind of explain, it's like, this is the process. You need to get accepted, everything like that. You'll still need to go to MEPS. You'll still need to do the rest of the stuff, and then go into either take strap, or 6 months from graduation, you can come on board as a fully qualified. And like you said, I don't know what our mission looked like as far as being able to close that position. So for those that don't know, we have, at the beginning of the year, we get told we are looking for 50 PAs. And then that's worldwide. But there's a few things that can happen. They can say, it's like, we're looking for 50, but we'll take more.
Yeah.
Or they're like, hey, 50, nah, that's it. That's all we're looking for. And what they do is they reevaluate that every year. So one year they say 50 and we bring in 40. Then next year they may ask for 60. Or they may ask for 80. So we don't know. The best you can do is get a hold of one of us, talk to us, and let's get the process rolling, because there's nothing that says that, even though it may be closed this year, to get everything ready, and we just literally have your packet sitting there waiting. As soon as the board opens up, here you go.
Exactly. Yep. It's always best to submit your packet at the beginning of the year versus later on in the year. So yeah, the earlier the better.
Yeah. Has there been any? So I know you worked with PAs quite extensively in your career. Have any really stood out to you, like as far as their background, what they've taught you, what they've learned and kind of passed on? While you're thinking, I can kind of explain one of them. I worked when I was deployed. I had not only my PA but a Profis doc. But when we mentioned the special operations side, I was not in a special operations unit. I'm not that good. But I was in the same location as one. And there were a lot of things that in the middle of Afghanistan with very little equipment, like doing a bone debridement and setting up a wound vac. Like that is something that you do not see out in the middle of the mountains.
Yeah.
Just because we were not able, now that it was not on a US soldier, it was not on a coalition soldier. So it was actually on an Afghan local. But we did everything we could to make sure that he didn't get an infection. He didn't die of sepsis. He still was able to maintain range of motion in his shoulder. He was still able to do everything that he could to maintain a quality of life for him. So we did all that. We put a lot of money and experience into him. Now, was I leading that? Absolutely not. I was the medic just assisting on it, but that was one of the coolest things that I've been able to do. And it was a PA that was doing it. It wasn't a doctor. It wasn't a surgeon. It was a physician assistant that was sitting there with Sergeant Sharps when I was, this was 6-7 years ago, like just by ourselves. So that's kind of the things that I've seen from the PA Corps, and I have a lot of respect for them when it comes to like what they can do and what they have done in the past.
Yeah, I guess mine would be when I was in Iraq. I was at one of the FOBs in Iraq. Yeah, doing the night, it was doing the change of shift, and just having a PA, that was my first time ever assisting, insert a chest tube. And I'm like, wow, that was, yeah, I'm like, whoa, okay. And, they train medics, but I would never, if I'm out there with the infantry soldiers, I would never try it. One, it's different from when in a training environment and on a real life patient, kind of like intubation. And two, I just would not want to open a soldier up like that and set him up for an infection in that type of environment. So definitely not. But yeah, that PA was pretty good. Got it in. I was like, man, I was definitely impressed with when he assisted him inserting that chest tube.
Yeah, I mean, I've done chest tubes as well. That's something that on the enlisted medic side, as you progress further and further in your career, and there is trust that gets built up between, especially with your treatment medic. So your treatment NCO, who's typically that staff sergeant in the aid station, that level of trust with the PA, because there's only one PA. I'm sorry, he can't be up 24 hours a day. So he will empower that treatment NCO to make those calls and make those decisions. And whatever he said, like whatever decision gets made, that PA will back him up 100%. So it's like, nope, I trained him. He knows what to do. So inserting a chest tube, yeah, I've done it. Like doing a crike on somebody. Like I tried to go for the intubation, honestly. And I was getting a nerve response. I'm not going to go into it because it's a little bit gory. But I jumped straight to a crike, like secured that airway, done, passed him off. So it was, it's being able to train those people to be multipliers for you, to be able to assist you in those more advanced skill sets. Or, well, the PA jumps to the most advanced intervention he can do. He can trust the medics to do everything else for the patient. So he's not worrying about managing all of the hemorrhages, all of the breathing, if he needs to do one specific intervention.
Exactly. Yeah. And when the PA's trained you on suturing, typically if they have trust in you, really the only time the IPAs would step in to do the suturing is unless it's on somebody's face. Then they're like, hey, I'll do that. But if it was like on a ligament, extremity, arm or leg, they're like, hey, yeah, I trust you. I trained you well.
Or like if it's like a deep tissue. So if you're suturing muscle and like trying to reattach the fascia, stuff like that, then I've assisted on it. I wouldn't even trust me on it just because the ability for infection is so great. And like, because you're down that deep, you have to realize at what point you need to put in a wound drain, and to be able to close it up without it getting like an abscess. There's a whole wide variety of things that I'm not trained on. All right. So, hey, that's it for PA right now. Thank you very much, sir, for joining us. I know it was kind of a marathon as well for these 2 hours in the beginning.
It went by quick. I enjoyed it.
But if you guys have any questions as far as the medical corps, so if you're a pre-med student, pre-dental, pre-vet, any pre-health science, I don't care what it is, send us a message. We can at least kind of help you out and guide you on the pathway of what you need to look at, what you need to set yourself up for. If you're going into those schools, when to apply, the same time you're applying for the school. Now, dental corps, apply early, apply in your junior year. Like that's the best advice I can give you, because if you wait, it will pass you up. It is once a year, and that is it.
Yeah.
Vet corps. So vet, again, while you're in your senior year, come talk to us, because we only have a 3-year HPSB for vet corps. Again, all of this may change next year. We don't know. But if you're interested, please reach out to us. We'll talk to you about it.
And one thing about the vets, I don't know if some have done their research yet, but with vets, they're unlike the medical corps, medical residents, vets are unable to defer their loans while they're in residency. Yeah. I found that out when I commissioned. I worked with a licensed veterinarian, and she wanted to join the Army Reserve because of the loan repayment. And she's like, nope, we're unable to defer our loans during residency. And she's like, I'm not certified. I'm in residency. Wasn't making a lot of money. She said it was some tough days during residency. I was like, wow.
Vets don't make much.
Yeah.
It's honest truth. Like, you go look up what a veterinarian makes, and then, yeah, it looks like a decent amount, but then you have to figure it's like you have student loans, you have a practice to maintain.
Yeah.
Like there's not a lot of like that, like, we have hospital systems that are starting to take over like primary care clinics. You still don't have, most vet offices are still family run. Like, you may have things like Banfield, like at the big box stores, stuff like that. But again, the majority of your vet offices are private practices. So you have to think of like your startup costs, getting in and partnering with some of these more established vets, whether they want to bring you on or not. So looking at the Army is definitely a good option when you're looking at the loan repayment piece. Going into residency, STRAP, student loan repayment, all that stuff's available too. But if you do have any questions, please reach out to us, send us a text, go to the link tree. I've tried to post every link that we discussed, from the pay charts to the BAH to our YouTube page. Again, go like us, subscribe, leave a comment. And what we'll do is we'll try and get every question answered. But for now, we're going to go ahead and jump off here for about 15 minutes. I need to go grab some lunch. And when we get back, we're going to have newly promoted Staff Sergeant Fant. She is our subject matter expert when it comes to Army research. So this is the side that you don't really hear about because it's not publicized. So she'll be able to kind of break it down, what research labs we have, what they look at, what they actually research, things that are public knowledge, not the secret side. We can't talk about that here. And she'll kind of go into that. And again, if you have any questions about what a researcher does, let us know. If you're on this channel and if you know anybody in the STEM field, so microbiology, virology, anything hard science, and we pretty much have a position available for it, especially on the research realm, master's degree and PhD level typically. So go ahead and share that, tag them in this, and we'll be back in about 50 minutes. Thank you very much, sir, for coming on. And I believe we will have you back on tomorrow with our special guest, Dr. Gebhardt.
Yes, ER physician, decided to join the Army Reserve at age 53. So he's definitely going to share his Army story.
Cool. Sounds good, sir. Hey, thank you very much, and have a good rest of the day.
All right. You too.